I'm here at the Trusted Doctor, a company from Tencent, and I'm talking to Adam, who basically gave us an interview. And Adam, what do you think is the whole focus and the whole goal of your company?
I think our goal is just leaving the technology to serve the massive population and based on our high quality medical service and make it affordable, which is the key. Yeah.
So let's unpack that. That is a nice way to say it. You basically start with the system as is, right? How it is in China, lots of hospitals, lots of doctors who have to work really hard, and you have created an online platform. Yeah. Okay, the online platform, what does it do for doctors? Because it's really focused on doctors. What does it do for the doctor who works in the hospital?
Actually, we started everything from a follow-up platform, so which is helping the public hospital doctor in public system to collect the patients in the main beginning and to automatically manage the patients. So our goal is to save doctors time and help them to have a pool of the patients, because in China there's no family doctor system, so we just try to build up our China version family doctor based on experts doctor in public hospital.
Yeah. And because in the public system they have terrible IT systems, you make a very nice, easy-to-use system for the doctor to basically manage all the patients and basically see how they're doing, and to also communicate with them when they're outside the hospital.
Yeah, that's what we do. Actually, we are the platform now, not just online. So online, we are the follow-up.
No, but we start first with the online. Certainly the online, you basically help and contribute to manage for the doctor to not work with the public systems, but to have a very beautiful system completely designed for them.
I think it's a complement, also like with additional parts with the public system together. So we are the environment to help the doctor manage their patients. It's a follow-up system. And because of that, the patients enjoy better care and better service from the doctor. And more importantly, this service, we can design a lot of automatic solutions to help the doctor save time. So they can provide a high quality care to the patients, which is in an effective way.
Very little time. The patient uses WeChat as a communication platform, and the doctor has your app where he basically can integrate it, exactly see what everybody wants to do. Okay, how many doctors are using your system?
Currently, the registered approved doctor users, there are 450,000 doctors there, and they're using our app to manage 10 million patients in our platform.
Yeah. There's 900,000 doctors who are, and half of them are verified real medical doctors, and the other ones are also can use yours.
Yeah, exactly.
So 10 million and 450. How fast is that growing?
For the number of the doctors, I will say it's not growing a lot quickly, because entirely in China we have 2.8 million physicians, and we have the 450,000, which already covers all the tier 1 and the tier 2 major hospitals. The remaining 2.4, they are more in the countryside and primary care, so actually we have all of them.
You have all of them, okay, yeah. And then, based on that platform, basically you provide extra services. Yeah. This is for free, until now this is for free for the doctor, and you add all kinds of little paid services like advertising and extra. What kind of extra services do you sell to the doctors?
They're like we have designed a lot of automatic solutions, structured question list, like additional assistant service from our nurse team. So all these services will be charged for the doctor if they want to serve their patients better, or save him more time, or just wanted to provide a better user experience or something. Yeah.
Okay, so basically that's what you can do. Okay, so that's number one. You have 10 million patients and 450,000 doctors. Then you went further and you went offline. You helped to give the doctors offline supports. How does that work?
So firstly, we built up the 10 data centers, which had just become the venue. We provided the doctor version. We work for the physicians to work. For our online doctor can brought in their patients into our venue to proceed surgeries, proceed physical consultation, proceed any further disease treatments there. And in the meantime, it's a data center, which is a pioneer project in China as well.
Yeah. So I basically, as a doctor, I can go to your centers and get a room, get a team, get all kinds of equipment, and basically charge by, and that's charged by the hour.
Yeah, exactly. It's more like you can just take a bag and you can enjoy all the medical service to proceed your surgery there. That is our slogan. Just take your bag, go there, enjoy. Yeah.
Do the work. Okay, so that's really nice as a shared medical place. Then you went also one step further. You also opened clinics specially for eye and for.
Actually, we started from the GP system first because in China the primary care is still the most urgent thing. The government wanted, the people wanted, but it's very difficult to develop because people lack of the trusted relationship with these doctors.
They do not want to go to the local hospital and they do not want to go to the family clinics. They are empty.
Small hospital, local small community hospital, they don't want to go. They don't trust the doctor there. It's lack of the thing there.
You want to basically help restore that trust. How do you do that?
Very simple. We open all our community clinics near our day surgery centers, where the city will have our day centers served. Because in our day surgery centers, the doctor physician work there. It's all from our online platform. They are the experts. They are the professional high-end physician in this area. So they become the technology support for our small GP centers. So small disease you can treat in our small clinics, and if you have further symptoms, you can transfer to meet with actual experts in our day surgery centers. And in the meantime, the community clinics, the small clinics, still can be the portal to catch up the nearby traffic. So it become a win-win game. Small disease treat there, further surgeries move to our day surgery centers, then everybody can generate the trusted relationship. Yeah.
How many of those different kinds of clinics do you have?
In total, we have 54 facilities, 52 or 54 facilities now in China.
That's growing to 200, right?
Going to 200, going to 500, I will say. Yeah, 500, yeah.
That's one thing. And then there's more specialty versions?
Sorry?
You have a surgery, you have also higher end facilities.
Oh, I mean, it's included for the two. So generally, we would like to reach the scale and we will have 500 community clinics and 54 day surgery centers in China. Yeah.
And so there's two models. One, the doctor from your online platform, the expert, can go to your center and rent a place, but you also hire professionals yourself and operate them on a profitable basis, right?
Oh, yeah.
Which operations do you do for yourself, which you provide yourself?
Sorry, you mean myself?
Yeah, not you, but as a company, the eye operations and the...
Oh yeah, actually we directly the day surgery center, firstly, it's also owned by us. It's also like, though it's a share version, doctor version, we work, but still it's a small hospital, and we are also hire doctor there. They also would proceed the normal hospital do. But in the meantime, it's like a doctor workshop. Like doctor will come, will proceed surgery, will do a lot of things there. That's business model one. Business model two is we also open like GP primary care, like GP clinics near our day surgery center. So we hire a doctor. We also have the normal disease treatment there, and the further disease will transfer to our day surgery centers. And in the meantime, we have the third business is the specialist care, which is the dental, eye clinic, traditional Chinese treatment, and any based on our existing reputation and the business model done in the city, we have located our day surgery centers and community clinics. It's very easy to catch up traffic for our dental clinic.
It's all about catching get traffic. You want traffic, and then you basically redistribute it and build a trust relationship. Also, to do that, you have a license to operate a virtual hospital. What can you do in a virtual hospital?
Sorry, you mean our online platform? Yeah. Yeah, so what we can do there, it's we can deliver, so either saying firstly, it's like a healthcare consultation, of course everybody can do, and then more importantly, we can deliver the e-prescription. That's the key. And
drugs.
Then based on the e-prescription, we can do the medication delivery. And based on that, we can build up our healthcare related e-commerce system. So that's all linked with each other. Yeah.
Okay, so you support the doctors online, you have a virtual hospital, and then you go offline to build all kinds of clinics, and you're building that out. How much money has been invested in your company?
Wow, that's...
you just had a $250 million round, and you're going to do a couple of rounds. So you are investing big in this company.
Actually, I will say this. There's a lot of people asked us, what is the key of your defense of your business? I will say this. how did we reach today's scale? The 250 million USD, we are just newly financed and for our further development. But we have already spent detailed number, I don't know, but maybe like a billion USD, or not a billion, 100 million USD, or maybe better, or maybe higher, maybe lower, this money to develop all this business. That's the most difficult.
And for that, you have how many employees are working here?
Around 1,000.
1,000 people. And there's how many are IT people?
300 of them are IT engineers. Yeah.
And then you have nurses, and you have nurses who basically help to.
And the doctors, and also they work in the first tier, and some of us work in the headquarters. Yeah.
Now you have been bought by Tencent, and since April, you're part of Tencent. Yeah. What has that brought to in vision to the company? That connection.
Actually, Tencent Group helped us with like a lot of things. The most key is the traffic, because they directly brought in the clients' traffic. Originally, we are more the follow-ups platform to serve the physician and serve their patients. And also, of course, we will have some clients' traffic, but that's limited. But now, the Tencent, they directly serve 1.6 billion population in China. Yeah. So now, we can help the Tencent Group to serve the 1.6 billion, the entire China population. Yeah. So they become our clients' traffic pool. Yeah.
So now you become a real center of the healthcare traffic for patients.
A healthcare center, I would say. Yeah.
And based on this platform, online and offline, what are your next plans for the future? What kind of products are you going to provide?
The key product, which is still sensitive, but I will say we are developing the China version Family Doctor. That will be the key product. Leveraging all our resources, online and offline, to generate the China version, how to serve the patients better in our way, which we may consider the physician resource we have, the offline facilities we have, a lot of creative products we have online and offline, how to leverage all these to serve the patients.
And that will come in the next year?
Yeah, very soon. Yeah.
If you would say the soul of this company, what drives this company? Is it to make as much profit as possible, as quickly as possible, or is it to play a role in the whole transition of the healthcare? What would you say motivates most the people here?
I think we have three key motivations. Yeah. The first is the right direction. We have three partners working in our company. They are all very experts in like healthcare, in internet, in financing. So they are leading the company from the right direction where the China industry, healthcare industry development. So we think that China is moving to the universal healthcare industry, and the government is leading that way. So we follow up that direction to develop our business. The share version doctor we work, the primary care system, and the family doctor we are going to generate. All these products suits the direction where the government and the local people want it. So I think the right direction is the core of where leading us. Yeah. Secondly, I think the SOP is a key. Because our
standard operating procedures, and you're an expert in that. You have a lot of them, right?
A lot of them, yeah. Because our philosophy is the medical service is a very priceless service. So you need to make sure every standards, every step correct. It cannot be run by person. It should be run by system. System doesn't mean IT. You need to have the entire SOP, the procedures for each step. Yeah.
So we need to be of high quality so that with normal people you can deliver high quality care for a very reasonable price.
Yeah, that's the third. That's a third philosophy we are going to adopt, and just make every our service affordable by the massive population, because we serve the entire Chinese population. So we don't do the high end. That's a small group. They will enjoy the private care in some other ways, but we serve the massive population. So we focus making the pricing similar or even lower to the public system.
Yeah, because the bill, which basically all your doctors, is the public healthcare insurance.
Yeah. So, and our service, because we can, I think the key is control cost in the first beginning. So we control the cost from online and offline to save everything and make our pricing similar to the public system. And because of that, the commercial insurance, of course, wanted us to join them. And more importantly, the social insurance, it also recognized our contribution in this area. So our also business is joined the social insurance system paid by the government. So that's a key. And I think what is also important for the mass population, they can enjoy the social insurance. Yeah.
So you give fantastic products for a social insurance price. Now, 10 million is nothing. Right, in China. It's nothing. You have a quarter of the doctors, but you have nothing. When are you going to reach 100 million, 500 million, and 1 billion people?
Well, I will say, we hope with our growth of the scale in the next 2 years, we can reach, I don't know the detailed number because we calculated by sites. We will open 500 clinics in China, so I don't know how.
But 100 million, when will you reach 100 million?
It will cover around like, I will say 30 to 50 cities. So how many? Each city will have 10 million patients. So that's the population we will serve.
Thank you very much.
Thank you.
Appreciate it.
Yeah, appreciate that well.